Welcome to the 17th Journal Club by the European Journal of Cardiovascular Nursing. Our topic today is delirium after cardiac surgery. My name is Britt Borregaard, and I'm a PhD student from Denmark, and I'm going to moderate our journal club today. With us, we have Irene Instenes from Bergen in Norway. Irene is a nurse specialist within the field of geriatrics, and she is the first author to the paper, I Hope You Get Normal Again, an explorative study on how delirious octogenarian patients experience their interactions with healthcare professionals and their relatives after aortic valve therapy. Welcome, Irene.
Thank you so much for the introduction, Britt. And I'm so honored for the opportunity to participate in the European Journal of Cardiovascular Nursing Journal Club and present our study. As Britt said in her introduction, my name is Irene Instenes, and I work at the Department of Heart Disease at Haukeland University in Bergen in Norway. And I finished my master's degree at the University of Bergen in 2015. And my topic for the master's degree was octogenarian patients' experience with postoperative delirium after aortic valve replacement. And in this study, we interviewed 10 patients 6 to 12 months after the procedure. And during these interviews, there came up some interesting information regarding the experiences the patient had in the interactions with healthcare professionals and relatives. And that's why we wanted to explore this topic further, both postoperatively and in the long term. But let me first start with giving a brief introduction of delirium and how this syndrome manifests. Delirium is a common and serious condition and complication among all the patients in hospital. Patients that receive valve surgery runs a higher risk of developing delirium than, for instance, coronary bypass patients. However, cardiac procedures are identified as being an acute stressor and increase the risk of delirium. And delirium is characterized by sudden onset, fluctuating course, and decline in attention and cognitive functions. And the syndrome manifests in 4 forms: the hyperactive form, the hypoactive form, and the mixed form, and at last, no subtype. Patients in hyperactive form is not difficult to identify. These patients are often agitated, restless, hallucinated, removes medical equipment, and intravenous lines. The hypoactive form, in the other hand, is the more silent type. In these patients, you find decreased psychomotor activity. They often lie still in bed, appear sleepy, and is difficult to create contact with. And these patients have the worst prognosis. The mixed type does have elements from both hyperactive and the hypoactive type. And at last is the non-subtype form. These are the patients that you can't identify either in the hyper or hypo or mixed type group. But nevertheless, while interacting or communicating with the patients, you notice that there are some deviations in the person's appearances. Delirium is associated with prolonged hospital stay, readmissions, the need for further institutionalization, increased healthcare costs, and mortality. There is also evidence that the patients remember the delirium experience for a long period of time, and the stress is seen to influence the way patients cope with their deliriums in a long term. And during the delirium, the patient's behavior can change rapidly and unexpectedly, and often with health care professionals and relatives present. For relatives, this experience might make them feel confused, burdened, and distressed. And for healthcare professionals, delirium severity and perceptual disturbances are the strongest predictor of distress. Especially the impact delirious patients has on nursing staff has been highlighted. But even though delirium is a major medical problem for older surgical patients, few studies have described how octogenarian patients experience their interaction with healthcare professionals and relatives by being delirious. And therefore, the aim of this study was to explore this topic further. So,
thank you, Irene. That was a nice introduction of both the topic and your paper. We all know that suffering from delirium can be quite an emotional challenge. Was it difficult conducting interviews on such a personal topic?
Oh, that's a very interesting question, Britt. I conducted the first and initial interview, and one of the co-authors conducted the 4-year follow-up. And I have to admit that I was a bit nervous before I started the interviews. I did not know what reaction I could expect from the patients, but luckily it went very well. This was partly due to a thorough question guide, a pilot interview in advance, and not least, very open-minded participants. And during the interviews, the patients spoke very freely about their delirium experiences. And more than one felt insecure during the conversation. And this was especially related to that their delirium experiences could be of importance in a research project. But after a calming introduction with a clarifying purpose of the interview, the conversation went very smoothly. But nevertheless, it became clear in some of the conversations that the patients felt very uncomfortable talking about their disorientations and confusions. And for some, the delirium had made them feel like they lost control over themselves.
Yeah, that makes sense. But what were your main findings then? What did the patients experience?
In the initial interview, the main focus were postoperatively delirium experiences. And it became very clearly during the interviews that the patient experienced the delirium state very differently. For some, it was perceived like a fascinating condition. They did early realize that what they were experiencing was hallucinations and not reality. And it was described a bit like dreaming while awake. However, there were also patients who had completely different experiences. Especially evening time was perceived as difficult, very difficult for these patients. Anxiety, fright, and panic were emotions frequently described together with horrific hallucination. For instance, one patient experienced the pipeline line along the ceiling fully packed with crawling animals. And suddenly the wolves came straight towards her and she screamed loudly out in panic. And for another patient, the delirium was so frightful that all she wanted was the nurse to come and sit with her and hold her hand for a while.
Yeah. In the paper, you also write that the patient expressed that it was essential for them to have their care buyers near while being delirious. Can you tell me a little bit more about that?
Yes. The patients expressed very clearly how having healthcare professionals and relatives have a soothing effect while being delirious. Today, in most cardiac departments, there is a mix in age groups, and it's very challenging for the healthcare professional to get enough time to be close to the patients all the time. And one of the patients described very clearly how his wife stayed with him most of his hospitalization. And she safeguarded him through the delirium and through his confusions, hallucination, and panic attack. And this was also repeated in a follow-up interview. So this patient remembered very, very clearly how important caregivers had been for his rehabilitation. Another patient referred to her grandchild being her consolation and being together with her most of her hospitalization, and how she had comforted her all along.
Yeah.
Yeah.
But why did you only include octogenarians? Means that you only include patients at 80 or above. I guess that the prevalence of delirium might be different among older patients, but did you expect their differences to be different?
Yes, the whole intention of this study was to focus on patients age 80 and above. And that's because in recent decades, the healthcare system has witnessed a growth in number of old patients. And a significant proportion of these patients are in the age group between 80 and 89 years of age. And aortic stenosis tend to positively be associated with advanced age. And this means that we have to look a bit further and closer to this age group. And as different from other age group, octogenarians are more vulnerable. They have more frailty situations, and they need to be followed in a different way than younger patients. And while we did this study, we saw that they did differ a bit from younger patients. And we thought that after the study, we could we could give them more satisfactory care. Because we did know a bit more about this age group.
Yeah, that's a very good point. In your paper, you also say that you have some problems recruiting the patients. Why do you think that was, and did that influence on your findings?
Yes, the patients in the qualitative study were all recruited from a larger prospective cohort study titled Cardiology. And in the initial quality study, there were 13 eligible patients. And at first, we wanted to recruit patients 6 months after the procedure. But unfortunately, 5 candidates did not remember the delirium, 2 declined to participate, and 2 withdrew their consent. So only 4 patients consented to participate. And due to this small number of included patients, we decided to expand the time window from 6 to 12 months after the procedure. So we sent out a new detailed letter to 9 new patients. So altogether, we got included 5 women and 5 men to participate in the initial study. And so we wanted to do the follow-up study. And we then also wanted to invite the 10 patients to participate in this study. And one of the patients, unfortunately, had died during the 4-year time period. And therefore, only 9 patients were eligible for participation. So we sent out a letter to all the 9 patients, and 6 patients responded to this letter, and 5 consented to participate, 4 men and 1 woman. And we are very satisfied considering the age that 5 of the patients wanted to participate in the follow-up study.
Yeah.
Yeah.
You just mentioned that you interviewed the patients 6 to 12 months after the episode of the delirium. That's quite a long time after. What did that mean to your findings?
I think that strengthened the findings because the patients remember their delirium very clearly, even after 12 months from the procedure. And that was something that amazed me, that they could really give a detailed information about how they had experienced the delirium incidents. And they could still remember after 4 years. So I think that was a strength for the study. Yeah.
Yeah, I think that's an important point.
Yeah.
It actually means something, a lot to the patients. And I think that's why this study is very important. I have a final question for you, Irene. If you were to do the study all over again, what would you have done differently?
If I should do the study all over again, I would try to conduct all the interviews in office at the hospital, because due to the patient's old age, we did go home to the patients and do the interviews at their homes. And when you come to older people in Norway, they treat you like a guest. They make you coffee and serve cakes. And yeah, and that was very nice, but it influenced a bit on the researcher-patient's relationship. So I would prefer to do the interviews in an office. But as you know, Norway is a long-distance country, and some of the patients had several hours of traveling time if they should come to the hospital. So it was easier for us to go to them. But on the other hand, I think they felt very comfortable doing this in their own home, and we got the rich data material. So maybe it has been very positive. Yeah.
Yeah. Good point.
Yeah.
Thank you, Irene. That was a nice discussion of your paper.
Thank you so much.